Okay, I'm going to try to get through this last one before I lose my voice or something. So we're going to talk about the rest of the endocrine disorders and some of the medications to treat thyroid issues. You know, primarily we can have hypo or hyperthyroidism, and we have drugs that can simulate the thyroid hormones, and we have drugs that can destroy thyroid tissue to lower thyroid hormones. So a lot depends on what the problem is. You can certainly review issues related to thyroid disorders. Mainly remember that the thyroid is metabolism, and symptoms of low thyroid are going to be low metabolism, and symptoms related to high thyroid are going to be high metabolism, and what all of that entails. So thyroid replacement hormones are typically used to replace T3 and T4, more often T4. They're typically synthetic, though natural hormones can be used. Levothyroxine is the most commonly used. Trade name is Synthroid. It's what most of us are familiar with when giving medications for hypothyroidism. The desired effect is to return the patient to a normal thyroid state. So if a patient is experiencing hypothyroidism, then chances are they're gained some weight, they are sensitive to the cold, they seem lethargic, their heart rate might be slower, body temperature lower. So these are the things that we would look for to change once we started giving the medication. We want these things to come back to a more normal alignment without being excessive. So a big change, sudden loss of excessive weight, pulse rate above 100, an elevated temperature without an infection, suddenly running all over the place, doing everything and not sitting still, might be indicators of too much medication. Doses are typically adjusted over time and in relation to therapeutic blood levels. So patients do need to have their serum levels of T3, T4 monitored on occasion. Adverse effects are typically related to too much drug and are symptoms of hyperthyroidism. So we want to teach the patient what those symptoms are. Initially, they might be happy. They're happy they're gaining weight or losing weight. Pardon me. They're happy they're not cold anymore. But eventually, those things become an issue for them as well. They need to know this is lifelong treatment. They don't get to quit taking it once they feel better. But they have to take it for the rest of their life. Best if it's taken in the morning on an empty stomach before any food. It's also best to take it in the morning or whatever their morning is, because it is designed to increase their metabolism. It's going to increase their energy levels, their desire to do things. We certainly don't want to give that late in the afternoon or early evening when they should be going to bed soon. Once started on thyroid replacement, patients requiring insulin, oral anti-diabetics may require adjustment in the dosages of those medications. with increased metabolism is going to come increased utilization of glucose. Now, anti-thyroid medications are going to do just again as the name implies. They're going to be against the thyroid. So they're going to actually destroy the hyperactive thyroid tissue. Iodine 131 is a radioactive isotope of iodine that is absorbed into the thyroid gland in high concentrations and will begin then to destroy the thyroid tissue. It's not used for everyone with hyperthyroidism. It's typically used prior to surgery to shrink the enlarged thyroid, or for patients who, for whatever reason, might be unable to undergo thyroid surgery. It may take the patient 3 to 6 months to see a full benefit. Now, did I say 3 to 6 months? I just can't remember that I said a long time. The actual product is dangerous when it's out in its container. So it has to remain in a closed container